Welcome to Dr. Nurse Paul Show, hosted by Aspire RN and Dr. Paul. You are watching The Secrets of Next Generation NCLEX. Dr. Nurse Paul is an NCLEX expert, having trained and mentored thousands of international nurses past the NCLEX RN for over a decade. He graduated with a Doctor of Nursing Practice in Texas Christian University. He is a registered nurse, an advanced practice registered nurse, and a certified family nurse practitioner. He also has completed a certificate for nurse educator postgraduate course. Aside from teaching, he has extensive clinical experience in emergency and family medicine. He has over 15 years of combined clinical and academic healthcare experience. Dr. Nurse Paul is an immigrant from the Philippines. He is currently based in Houston, Texas, where he operates his business, Dr. Nurse Paul, and Aspire RN NCLEX Prep. He loves to share his life story of how he overcame his challenges to reach his dreams. He is passionate in helping nurses realize the American dream. So without further ado, let's all welcome Dr. Nurse Paul.
Hello, everybody. Thank you for joining the Dr. Nurse Paul Show. This is our first episode, and we are talking about the secrets of Next Generation NCLEX. Hello to everybody. I'm live streaming here from Honolulu, Hawaii, and it's 3 a.m. in the morning here in Hawaii. May you guys please write down where you guys are located, comment your location and your local time right now so we can figure out where everybody are coming from, right? And do me a favor so we can reach out more people with this live show right now. If you guys can please click the share button for this show so we can reach more nurses. We're going to talk about Next Generation NCLEX. We have nurses coming from Oklahoma. From the mainland U.S., we have nurses from Dubai. It's 8 a.m. right now in Oklahoma. I believe it's Central Time because I'm from Texas, and it's in Central Time as well. We have nurses from the Philippines, from Oman. It's 5 p.m. right now. and more nurses coming from Philippines. We have nurses from Vancouver. Thank you, guys, for joining. And we're going to be talking about a lot of stuff with the Next Generation NCLEX. This is going to be very exciting. I know a lot of nurses are looking forward to know what Next Generation NCLEX is all about. We've been hearing stuff, but it's not complete. Well, I'm here to discuss everything that you need to know, the secrets of Next Generation NCLEX. So do me a favor and share this show right now to your pages and your Facebook walls, so more nurses can be reached out through this live show. We're also streaming live in YouTube at the Dr. Nurse Paul Show. So if you don't have a Facebook, you can also log on to YouTube and look for my channel. And we are live streaming in YouTube as well. More nurses are coming in, and we now have nurses from Saudi, Middle East, and Philippines. And there you go. So more nurses are coming in. Thank you so much for joining the Dr. Nurse Paul Show. I'm so excited to talk about the Next Generation NCLEX. Recently, I attended the NCLEX conference of 2022, which concluded last week. And aside from the things that I already know about the NGN, there were so many things that I just learned last week. And it's so exciting to share these things, because I know a lot of nurses who will be taking their NCLEX next year will really benefit from this. So thank you for joining me, and please make sure to share this page. All right. And anyway, I posted in my Facebook that this pilot show of the Dr. Nurse Paul Show, we're gonna do a giveaway. I'm gonna have two winners for tonight. Tonight in my time in Hawaii. For today, we're gonna have two winners. First winner will have an NCLEX Short Pass Pro subscription, 1 year unlimited NCLEX review program from Aspire RN. And the second winner will win not only an NCLEX Short Pass Pro review course from Aspire RN, but also an NCLEX processing with all application fees paid for by the Dr. Nurse Paul Show through NCLEX Pro, our partner, NCLEX Processing Center. So to win this, you have to like the Dr. Nurse Paul Show Facebook page. You have to share the event posters and share this show and comment done and shared. When you are done with this, you're going to be automatically entering the raffle. And later on, we're going to use a comment picker. Our team in the background will do a comment picker kind of thing, and it will choose the two winners for tonight. And more nurses are coming in. Philippines, Nairobi, Kenya. Welcome to the Dr. Nurse Paul Show. This is very exciting. I have so much to share tonight. I know 1 hour is not enough time to do this, but don't worry, we're going to be doing this every Monday. I'm sorry, every Saturday, all right? And we're going to be learning a lot from the Next Generation NCLEX. Eventually, I'm going to do sample questions and teaching you tips and strategies of how to attack those questions. We're still about 6 months away from the full implementation, so we're going to learn a lot. If you guys are taking your NCLEX exam in the first quarter of next year or last quarter this year, you will not be affected by the Next Generation NCLEX, but it is coming and it will be here very soon. So might as well prepare for it if you're a nursing student right now or you're going to take your NCLEX next year. Okay, so more people are coming. Thank you for the viewers. And so let's talk about the Next Generation NCLEX. All right, I can see y'all's comments. This is live streamed in multiple pages and YouTube. I can see all of your comments on my screen right now. So if you have questions and if I have time, I'll answer them. But please do put them in the question box, or I mean in the comment section, and I'll gladly answer them when I get the time. If not, I can go back to this within the next 24 hours and respond to your messages as well. But thank you for joining. Now, Next Generation NCLEX is the newest version of the NCLEX examination, both for the registered nurses and practical nurses. But I'm only going to talk about registered nurses for today because that's my expertise. And this is going to happen next year. The National Council for State Boards of Nursing, the boards of nursing for all the 50 states, plus Canada, have already started planning for this for about 10 years. It was going to be implemented in 2022 this year, but because of the pandemic, it has to be pushed back to another year, giving us one more year to actually prepare as educators and for you students as well for the new or the next generation NCLEX, right? This is evidence based. This is worth of 10 years of literature research to figure out what really should come out in the NCLEX to identify the entry level minimum competency skills of nurses to practice safely and effectively. That's the main goal of the boards of nursing, for nurses to practice safely and effectively. And these next generation NCLEX style of questions are going to be implemented for both the United States of America and for the Canada NCLEX. It's all the same exam. It's just a matter of where you apply. And for foreign graduates like me, I'm an immigrant nurse here in the States. Australia might also require, from what I believe, Australia is also requiring foreign graduates practicing in their country to take the NCLEX. So this is going to be huge. Like I said, we've been preparing for it for 10 years in the academic world, in the nursing academic world, but nobody's really prepared for this. So now we're going to talk about what this is really about, all right? And the first question is, why do we need to change the NCLEX? Why do we need to update it to the next generation NCLEX? Next generation NCLEX is very complicated. It's a lot of high stakes, high difficulty questions that will really challenge your comprehension and skill. So it's really difficult if you're not aware of how these questions are going to be framed, right? So the question is, why do we need to change it? I've seen a lot of questions in my TikTok recently once I posted this next generation ethics. And this is why I'm making this show, because I posted one thing in TikTok and in Instagram and it blew up. And now I have hundreds of comments that I couldn't reply to. So I was like, you know what? I'm just gonna sit down and create a show that will address all of these questions, so I can, talk to many people at the same time and talk what next generation NCLEX is all about. So the main reason why we're changing the NCLEX is the National Council for State Boards, the NCSBN, the boards of nursing of all the 50 states and Canada, right, have convened and figured out the NCLEX that we know right now does not accurately measure the minimum competency of nurses. The main thing that we're talking about here is called clinical judgment, all right? Clinical judgment is the reason why we're implementing the next generation NCLEX. And for the NCSBN study that they conducted for almost 10 years, since 2012, all of their references are published in their website, right? They found three problems of why clinical judgment is important for the next generation NCLEX, right? The first thing is clinical judgment was found to be a very important skill for entry level nurses. They conducted studies and said that the most common nursing error is medications. Now, before you give a medication that's been ordered by the provider or the physician, we have to decide. I have to decide, should I give this or not? And if I don't give it, what do I tell the physician? I'm not giving this medication because based on my nursing judgment, on my clinical judgment, the patient does not need this right now, or this will complicate the patient's situation. So we found out that clinical judgment is a very important skill for entry-level RNs to prevent them from making mistakes. Entry-level nurses are those nurses that have just graduated from nursing school and has never practiced clinically. You know what we say, we learn one thing in school, but we learn so much once you're out there practicing nursing, right? Because clinical nursing is very complex. We cannot learn everything in school. So clinical judgment is lacking. Number two, the research found out that clinical judgment is integrated in majority of the nursing practice based on the literature studies that they did, literature review and surveys, and all of the research method that they did to figure out what clinical judgment is about. They figure out that 46%, number one in the survey that came out, of all the vital registered nursing tasks is all about using clinical judgment, and 75% of all the clinical areas have prioritized clinical judgment as the most important skill that the nurse would have. And the third problem is, and this is what we're going to talk about why we have next generation NCLEX, is the current NCLEX, the way we know it right now, does not directly measure the clinical or clinical reasoning or clinical judgment. So yes, we have an NCLEX exam, but it does not directly measure clinical judgment. It measures certain portions of clinical judgment, but not the entire portion of clinical judgment. That's why the state boards of nursing, the NCSBN, went back to the drawing board and say, you know what? We need to update the NCLEX to an NCLEX that will actually measure clinical judgment. So it all boils down to how do we prove that we're actually testing nurses if they have the clinical judgment needed to be a safe nurse when they become licensed. All right. So of course they're not going to give you license if they think you're not going to practice safely. So there's a need to update the whole NCLEX because of this. All right. Now, NCSBN on your screen, don't focus on it too much. This is a lot of academic jargon. They created their own clinical judgment measurement model. It's basically them saying, you know what? We can identify and evaluate nurses, how they answer the exam if they have clinical judgment. So they created their own model of how to measure through the NCLEX exam the clinical judgment. So basically, it's a lot of clinical scenarios or case scenarios. But I don't want you to focus on the whole thing you see on the screen. I want you to focus on layer number three, which we will zoom right now. It's called layer number three in this CJMM or clinical judgment measurement model. It's a clinical judgment assessment elements. Guys, please continue to share this show, all right, to be able to join the giveaway. And of course, so we can reach out to our nursing friends to talk about next generation NCLEX. Because for all I know, all of us are just talking about question changes, but not everybody's explaining why do we need to change it, right? So now going back in the layer three, there are six components of the clinical judgment assessment elements. These six components are what's going to be coming out in the case studies or case scenarios. I will be talking about this again later, right? So the whole clinical judgment measurement model, don't worry about that. I want you to focus on these six things because once you start answering case scenarios, if you're going to take the exam next year when the NGN comes out, you will have to answer them in order of these CJ assessment elements, all six of them. All right. Now, what are the NGN changes to the NCLEX? What really are the changes? We're going to find out right now. First of all, and this is what we always hear in social media and the different nurse influencers out there or academicians or all the other conferences that were created. And this is in fact true. There are going to be new types of questions in the NCLEX. All right. Before they said they were only going to change a few, but you know what? There are now 14 types confirmed, 14 new types of questions in the NCLEX RN. It used to be six, it used to be eight, all right? But now there's 14, all right? I'm flashing it on the screen right now, but don't worry, on my next Secrets of Next Generation NCLEX webinar or live show or talk show, I'm going to be talking about them one by one and giving examples. But to highlight something here, you know the multiple response or select all that apply? There's going to be two types of select all that apply now. You know the drop down that you guys used to do? There's going to be two types or three types of drop down questions now. So there's going to be a lot of different types. Close questions, bow tie questions, highlight this text questions, and so many other complicated ways of presenting the questions in the NCLEX. All right. So somebody asked me, will it become harder? I think the answer there is yes. You know why? Because a lot of us are not familiar with how this question style works. We all know multiple choice, and now we're probably aware of select all that apply. But all these other different types, we're not aware. So that's one thing, right? Even if you're the smartest student in the class, but if you're not prepared of how the question is framed, it can affect your test taking strategy, and can cause your scores to actually go down. So that's the reason why I'm doing this show, because I'm not only informing you about the changes, I'm also going to teach you of how to dissect these questions and answer them and give you tricks and strategies of how to answer them correctly, right? So, but don't worry about all these questions right now. You're going to attend my next show, and we're going to talk about all these questions in the future shows. And now there's two major types of how questions are framed. There are standalone questions and case scenarios or case study questions. Standalones are questions that don't have a case study. It's by themselves, and case scenarios are group of questions where the patient's case is evolving from simpler assessment types to the more complicated type, to where you apply your analysis, implementation, evaluation, nursing process. All right. So the case evolves. All right. So all of these standalone questions and case scenario questions can use any of the 14 question types that I've mentioned earlier. Okay. So it's going to be a little more complicated because now we're going to see actual case studies on the NCLEX. If you are in nursing school, you're probably doing a lot of case studies right now. Here in the United States, when we teach students, we teach them about case studies, right? Because, NCSBNF has already told us years ago, we're going to do a next generation NCLEX that is based on case scenarios, right? But I know some other schools internationally are still not using this. So international students will have even more challenge taking these exam questions just because of unfamiliarity, not familiar with how the questions are framed. And this is why we're doing that. And other changes, the minimum will now be 85 items and the maximum is 150. Right now, the minimum is 75 and the maximum is 145. So there will be additional questions. Minimum now is 85 items and maximum is 150. You have to remember that with this minimum and maximum items, 15 items will always be a pretest. When we say pretest, all right, it's not computed against your score. It is not included in your scoring system. So what am I trying to say here? NCLEX does always have pretest items. You will never know which part of your exam is actually a pretest or not counted questions. The key is to just keep going, whether it's a pretest or not. Those pretest questions are under research, but they're not going to tell you what, right? To cut it short, in your exam, 70 items will be operational or counted against your scores or will be counted. The maximum is 135 because we always take out 15 items because they're pretest. And the maximum hours will now be 5 hours beginning next year when the next generation NCLEX comes out. All right. So are you guys still able to follow me? There are more students coming in. Thank you so much. All right. And please mention me your country. I've mentioned a lot of countries earlier to where you are located so we can call your country and acknowledge your presence in this show. But thank you so much, guys, for participating. Now, going further, you remember the standalone questions and case questions that we talked about earlier, right? In the minimum items of 85 items, take out 15 because that's a pretest. There will be 70 operational questions or questions that are actually counted. In the 70 questions, 52 will be standalones, 18 will be case scenarios, all right, or case studies. Of these 18, there will be three case studies of 6 questions each. So think of three cases, probably one case about pancreatitis, or another case about maternal complication, or another case about pediatric congenital heart condition, something like that. Those are just examples. And from those cases will be 6 questions, right? Answering the 6 CJ assessment model questions. You see the boxes that I've included at the bottom of the screen, the same boxes that we've shown earlier, all right? So 52 will be standalone, 3 case studies of 6 questions each, total of 18. That will be the 70 operational questions and the minimum items. So what if, sir, what if I go through all the way to 150, right? 135 will be operational, 15 will be pre-test. According to the NCLEX conference last week, which I've just learned, right? If you reach the maximum, you can have as much, and there's no limit, there's no maximum, all right, or minimum, as much as 10 case studies. If there are 10 case studies and each of them have 6 questions each, you will be answering 60 case study questions, and that's almost half of your NCLEX exam if you reach the maximum score. So if you can finish your exam with a shorter number, better, so you can, not really get those case scenario questions, which can be very tricky, right? But then again, we'll never know how much you're gonna get, right? So might as well prepare you whether you get the minimum items or maximum items, right? And then again, don't be confused with this, because again, next week we're going to talk about the different types of questions individually and what are standalones and what are case scenarios. And today is just an introduction of what is NGN. All right. In the next shows, I'm going to go deep dive into the details of these questions so we can prepare you to prepare for NCLEX. All right. Next year, if you're taking your exam next year. So kindly share this show so more students or nurses can reach and hear the story about Next Generation NCLEX in details. Another update: there will be 3 types of scoring now: the 0/1, the plus minus scoring, and rationality scoring. 0/1 is you only get points for the correct answers and you do not get points for the incorrect answers. Obviously, this is the most straightforward or most common way of getting scores. For example, if there's a select all that apply and there's 8 options and you only got 3 out of 5, then your score is 3/5, right? The plus minus is commonly known as right minus wrong questions. So if the answers are 5 and you got 2 and you have 3 mistakes, then you get 0, because right minus wrong. You have 3 mistakes, you only got 2 answer correctly, that's 0. All right. That's even more crazier, I'd say, because what if you've only answered 3 and your mistake is 5? Now you get 0, right, instead of 3 points. So that's, I guess, a little harder and high stakes, right? More difficult. And the rationale is scoring even more complex, because these are answers in pairs or in triads, dyads or triads. Again, I'll explain this with examples on the next Dr. Nurse Paul show. So please tune in. Make sure you go like my channel in YouTube or Facebook, put on the notifications so it can notify you every time I put up events. In fact, if you go to my page right now on Facebook, the events tab is there. You can see the next shows that will coming up. And please join me, because I will teach you how to answer these questions and attack them. I will prepare you on how to see these questions and how to answer them properly over the next couple of weeks that I will be doing the secrets of Next Generation NCLEX. We still have 6 months to prepare for it. So that will be plenty of time to prepare you guys if you're going to be taking your NCLEX next year. Thank you for the newcomers. We're now we're having more nurses come in and join the show. Thank you. Another update. I guess this is one of the most welcome updates and probably one of my favorite updates. The lab values will now be shown in the NCLEX. Whenever an ethics question has a lab involved, say for example PT-INR, or is this a D dimer, or are we talking about therapeutic levels for digoxin, right? Lithium, we always get confused with that. Creatinine levels. Don't worry, because the NCLEX will now show the lab values. You know why I like this? Because I took my nurse practitioner board exam. And nurse practitioner board exam is more medical than nursing, right? It's about guidelines and treatments and what can we prescribe to patients and so on and so forth. All right. But we don't have to memorize lab values because we see lab values on the exam. And why is that? Why do we have to see the lab values? Because you really don't have to memorize lab values. Right now, here in the States, when we check the labs of the patients, we see the lab values right away, the normal values. We don't have to memorize the normal ranges. We just see them right away. So it's not consistent with actual clinical practice, if we're memorizing lab values before taking the NCLEX, and then when you actually practice in the hospital, you don't even need to memorize them because it shows you in the screen. To cut it short, lab values will now be shown. No more memorizing of lab values. I know a lot of people don't like numbers. And RRP, which is reduction of risk potential, where lab values are included. I guess, this is my guess, all right? Don't take my word for it, will be a little easier because of the lab values. Because before, I have to have students, my NCLEX students, memorize the lab values. We don't have to do that no more because the lab values will now be shown in the exam. And I guess for me, that makes the reduction of risk potential a little easier. All right. And that's about 9 to 15% of your exam. So that's like bonus, right? Because now we don't have to memorize the AST, ALT level. But if I'm teaching you risk reduction or reduction of risk potential, I'm just going to teach you how to um, interpret what happens when there's an increased AST ALT, what happens when there's an increased PT INR, what happens when there's a decrease in neutrophils, right? What happens when there is a decrease in platelet? I'm not going to have to go through the different normal values. So that makes it a little easier, and I like it that way because that's like US Medical Board and nurse practitioner boards. We don't have to memorize lab values. It's about time that nurses don't need to memorize this at all. So that's one of the good things that will be coming out from the NGN. And I've mentioned this in one of my TikTok posts. There will be three categories that will have changes, and I've highlighted that on the screen. Management of care will have 1% deduction, while safety and infection control and pharmacology will have 1% increase. This is for me really more I guess challenging because there will be more pharmacology questions now compared to physiological adaptation or medical surgical questions. So what does it mean to you? Well, there will be more drugs, more medications that you need to know. And good thing because I do a lot of pharmacology classes, so maybe you need to attend my class. But it's going to get tougher, right? You can see on the screen the changes. Again, this is only for RN test plan. LPNs would not have any test plan changes. It's going to be published on December 2023, the final test plan. But these are, the insider information we got because I attended the NCLEX conference, okay? But there's going to be more pharmacological therapy questions for sure, okay? And the passing standard, a lot of people said when I posted the TikTok, it's mixed responses. Some people said it's going to be easier, right? Because I already took it. I did the research question. It was easier. It was a lot easier. Well, it's actually subjective for us to say if it's easier or not. Because some people might feel like it's harder. Some people might feel like it's easier. But you know what? Let me say this straight. And I've learned this from the NCLEX conference last week, right? The passing standard has not yet been set. The National Council for State Boards, all the boards of nursing, 50 states plus Canada, will sit down on December 2023 to decide, are we going to increase the passing standard, make it harder? Are we going to decrease the passing standard, make it a little easier to pass? Or are we going to keep it that way, same as in the last 10 years? We don't know if the boards of nursing are going to increase or decrease the passing standard, right? We're going to hear about it in January 2023. Crossed fingers. Hopefully, they make it a little easier, but I'm not counting on it, all right? The boards of nursing are not here to make it easier to pass the licensure exam. Again, the licensure examination is to make sure that we're practicing as safely and as effectively as possible. Making the exam watered down or making it easier does not really connect with their purpose to make us safe and effective nurses, right? So don't count on it. But January 2023, the NCSBN will tell us the passing standard, all right? So we're not sure yet if they're going to make it easier or harder, right? So many changes. Now, when will the NGN be implemented? It will be implemented on April 1, 2023. All right. Now, for those newcomers, again, you guys are can win my giveaways. I have two giveaways. One is NCLEX SurePass Pro review course from Aspire R, and it's 1 year unlimited with personal mentorship review class or prep course for the NCLEX. And the other one is NCLEX SurePass Pro review course plus application fees sponsorship. Right, you're gonna get this for free if you win the giveaway. All right, we're gonna give you a few more minutes. All right, we're gonna draw the raffle soon. So please follow the mechanics shown at the bottom of this screen. You have to like the Dr. Nearest Paul page. You have to share the event poster and share this show and comment done and shared. And one more thing, when you share the show, it has to be public because our team will verify by going into your profile and checking if it's actually been shared in your wall. I know some people are very private with their Facebook, or they restrict their Facebook, so we could not see what you guys are posting. For this purpose, please make sure that your sharing is enabled as public, all right? So we can see, the team can verify if you've won, all right? And we're about to draw the winners soon, all right? So our team is about to draw the winners in a little bit, all right? So, because we're about to wrap up the class, all right, or the live show today, all right, and more people are coming in. I'm currently reading some of the comments. Thank you guys for joining, and thank you for joining. A lot of people from the Philippines, from where I came from, but also a lot of international nurses, US, Canada, and abroad. You have last 5 minutes to join the giveaway. Please make sure that you follow the mechanics. All right, last 5 minutes, and we're about to draw the winners. Okay, and thank you so much for joining. I'm not yet done. I'm still about to talk about so many other things, and like I said, there will be follow up shows to teach you guys of how to do or attack the NGN. All right. So, question that I got again from social media for those people that are following me: what should me as a nurse do to prepare for the NGN? All right, for next generation NCLEX. All right, what should the nurses do? All right, one, improve your knowledge and comprehension. All right. Here's the thing, and you need to remember this: while the exam format will change, the content, all right, the nursing education content will not change. All right. The MI, for example, myocardial infarction, will remain as MI regardless if it's next generation ethics or not. You understand me? What does it mean? You have to really know all of your nursing stuff, all of your nursing sciences, right? If before you were barely passing the exam with multiple choice, with NCLEX you can't do that. You have to have a good comprehension, good knowledge of concepts. And not only that, you should be able to connect, concepts from pathophysio to pharmacologic treatments to procedures that we need to do for this patient, or how to improve safety for a patient with risk for falls because he's taking sedating medications. You should be able to, connect concepts, multiple concepts together, because that's how case scenarios will test you, all right? And you will not be able to answer those questions, those high level, high difficulty questions, if your comprehension and knowledge are not good. The foundation of your knowledge and your comprehension is important, all right? So preparing for the NCLEX is now more important than ever. Before, you do not have to attend prep courses. You can just, do question banks and you're good. Well, maybe it will change when the NGN comes out, all right? Because now you have to understand processes better. When we talk about pathophysiology, you should be able to know this very clearly, right? You have, I guess, 3 minute or 1 minute left, all right? To join the show, make sure to join the giveaway, make sure it's been shared publicly, all right? So we can see it, because the team is about to wrap up and tell us if they're about to draw, all right? So I have a team of people in the background that are about to start the draw for the giveaway. Thank you for joining. Everyone who's followed the mechanics are automatically qualified in the raffle, all right? Next, all right, do plenty of NG and practice questions, all right? So, aside from improving your comprehension and knowledge, very important that you develop your test taking skills. Familiarity with these different types of questions is important. If you're not familiar with these types of questions, when this come out in your NCLEX, you'll be surprised and you'll start to panic and you'll start to get anxious during the exam. We don't want that. And the only way to do that is to do plenty of engine practice questions. All right, a lot of question banks now are doing engine practice questions. I will be doing engine practice questions in my review courses. I will be conducting master classes of how to attack engine questions, and I will release that next year in January. I mean, because it doesn't make sense to release it right now. You guys are not going to be, I'm sorry, you guys are not going to be taking the NGN right now. It's going to be next year. So anyway, do plenty of NGN practice questions. That's the only way to really get yourself accustomed to NGN. All right. And some people say, oh, you know what? I know how to do NGN questions. Actually, it's different. It's high level, high stakes question. I've been starting to write my NGN questions since 2 months ago. And even then, I'm still polishing a lot of them because it's very difficult. And I'd like to put up this, question soon to teach you guys how to attack NGN questions when they come out next year. And the last one is join my NGN master classes. All right. The master classes are going to be released first quarter next year. All right. So you guys need more, training with NGN. Maybe I can help you with that. So don't forget Dr. Nurse Paul. And I'm conducting my class actually through Aspire RN. It's a company that I built, NCLEX prep course. I've been in the business for 15 years, but my company is new. It's only been in the last 3 years. I used to work for other companies before, but I'd like to have my own company so I will have my creative freedom because I'm not into money. I'm more into helping people, and my business is my way of reaching out to people and being able to help nurses to achieve their American dream. Just like what happened to me. I don't want to talk about my life right now, but my life story has been shared in social media. Check my TikTok, check my Facebook. Sigma Theta Tau has, featured my life story recently through a podcast. Sigma Theta Tau is the biggest honor society for nursing, and they chose me as one of their resource speaker or guests to share my life. And I feel very fortunate to have that opportunity to do that. But my life story, my struggles growing up and becoming a nurse and coming here to the United States are all out in social media. But I'm here to help you guys navigate these changes and make sure that you guys are successful in passing your NCLEX exam. So if this is something you're interested with, just follow my social media account, and I'll be announcing it soon once we get to the details. Right? And we're now done with the giveaway. The team is now drawing the winners in the background and verifying if they met the mechanics, and we'll be announcing the winners soon. And I'll give you guys 1 minute to tell me if you have questions. All right? Do you have questions so far? Again, if you have questions, how do the questions look like? What are the scoring system? Remember that I will be conducting more shows in the next coming weeks to talk about this thing. So make sure to follow me and watch my shows and tell your friends as well. Let's help your friends. Let's help your classmates. If you are a graduating nurse or you know a graduating nurse, tag them on my posts. This show is being recorded and will be uploaded in my YouTube channel and Facebook later, so you guys can still watch it if you missed parts of it. All right. Somebody said, Sir Paul, I'm scared. I would be scared to be honest. I took my NCLEX back in 2008. 2008, it's 15 years ago, 16 years ago. But I mean, I could still remember how scared I was. I would be scared too. But I mean, these things happen and it's inevitable. There's no way we can stop it. The only way that we can get through this is to prepare for this, right? It's like preparing for a war. We cannot say, oh, I'll just prepare for it tomorrow when the war is about to happen. No, you have to prepare way ahead because you don't want to cram for something like this. And Clex is gonna be tougher. It's gonna be more difficult. It's gonna be more challenging. Okay, but that's why I'm here. It's my passion to help you guys. All right. And there's a question: what is the best place in America to apply NCLEX? If you are a foreign graduate, the best options are New York State, Texas, Illinois, and Northern Marianas Islands. All of them have all right, different requirements. But you can check the board website, or I'm gonna post TikToks to run you through the requirement. But please visit their website by googling their websites, and you can actually check it there. All right, and like I said, don't get. This show wasn't meant to make you guys anxious. This show was meant to inform you that these things are happening, and it's really going to happen next year. And I want to prepare the nursing community by giving you a substantial, informative show to tell you what really are the secrets to the next generation NCLEX. All right. And please post more questions if you can. We still have a few more minutes before the show is to conclude. We're about to announce the winners very soon. The team is just verifying the winners. The comment picker has already selected, and we're going to be announcing it soon. Thank you to our sponsors, Aspire RN NCLEX Prep Courses. If you have questions about Aspire RN, please visit aspirern.com. We're doing a lot of NCLEX review courses. We have live classes, personal mentorships. You will be assigned your own personal student advisors, thousands of questions in the question bank, intuitive portal, so many other things. Please message my team. We're also thankful for one of our sponsors, NCLEX Pros and NCLEX Processing Center for foreign graduates. NCLEX processing can be daunting and very complicated. Let NCLEX Pro help you. Visit their website, nclex-pro.com, or message them in Facebook. Thank you to our sponsors. And Dr. Nurse Paul can help you with so many things. NCLEX prep courses, NCLEX application processing, NCLEX scholarships if you need scholarships to enter my NCLEX review classes, and recruitment referrals if you're looking to start your work here in the United States. Give me a message. I can connect you to the resources. I'm not here to make money from anyone, all right, except from the company that I put up. That's the only monetary um, financial disclosure to the public that's connected with me. But I'm here to help you guys get started. When I was an immigrant nurse, when I was a nurse back in the Philippines before, I was so confused with the whole process. But thankfully, because of the wealth of knowledge that I acquired coming over here, I may be able to connect you to resources. All right. So please send me a message in my social media. I might be able to help you. All right. And we're about to announce the winners, guys. All right. And let me see if my team are ready. Thank you, guys. Are you excited for who's the winner? We're going to have two winners today. The first winner will receive an NCLEX review package from Aspire RN. It's called SurePass Pro. It's 1 year unlimited, inclusive of personal mentorship, HIT classes, and final coaching. It will prepare you to pass the examination. All right. And let me message my team real quick if we are ready to announce the winners. All right. And the second winner will not only will receive two things for the second winner. All right. The NCLEX passing or NCLEX review course, prep course, and NCLEX application fee. So that's like full scholarship. You don't have to worry about processing. Somebody will pay for you for it. That's Dr. Nurse Paul, plus review courses for the NCLEX. All right. So you're going to win both. All right. So I think my team are still verifying winners, and make sure to put it in public, guys, because um, I think there are people that were disqualified because we couldn't see their post because it was kept private. So when we verified, they were not um, eligible to win. All right. So let me message my team real quick if we are ready to post the winners. All right. All right, and all right, they're verifying right now. We're having technical difficulties because we're making sure that the winners have actually shared it publicly. Okay, make sure to please publish it, the shares publicly, because the team is going to your Facebook profiles right now to make sure it's been shared publicly. Okay. Do you guys have questions about NGN so far while the team is verifying? We're about to announce the winner real soon. Okay. Questions? Where did I graduate? I graduated from the Philippines back in 2007 for my BSN, 2016 for my master's, and for my doctorate, I graduated last May here in Texas Christian University. So that was my most recent education. What type of questions are there? Any specific topics? The questions can be of any different client categories. It could be maternal, it could be pediatric, it could be geriatric, it could be pharmacology. There will be a lot of sample questions that I will show very soon, right? I graduated from Metro Manila. I'm from Metro Manila in the Philippines, if somebody's asking me, all right? I think we already have a winner. Give us a few more minutes. They're verifying it. All right. There are people who got disqualified because they weren't able to share it in the past. I mean, in their posts publicly. But don't worry, guys. In the next shows, we're going to be giving away free review classes again. All right. So somebody asked, would you recommend to take the NCLEX now or wait and take the NGN exam? I really, um, it's really up to you. If you think you're ready, take it now. If not, wait till after April 1st. All right. So there's really, it's a hard stuff to answer because I have not been able to evaluate your performance. But if you think you have enough time to prepare, sometimes things like work, family can take away your time from review and that prolongs your preparation. Also, have to consider how long you've been in school because some people haven't been in school or have gone out of school 10 years, 15 years ago. They would need more time to build their comprehension. But some nurses have just graduated from nursing school. So these nurses can take the exam in 1 month or 2 months' time. So it's really up to you, but you've got 6 months to prepare for NGN. If you are taking next year and you know you can't make it till April 1st, which is the NGN when it's going to be implemented, then defer for a bit until you can master the NGN questions, right? Somebody asked, is the NGN difficult compared to the NCLEX now? Just with how the questions are presented and just with how complex the scoring system is, it makes it automatically by default more difficult than the NCLEX now. Again, because of the complexity of the scoring system and with the questions how they are presented. So for me, um, they are more complex. All right, and difficult. All right, I think we have a winner, and the winner, all right, for our first winner who won an NCLEX review package from Aspire RN of NCLEX RN SurePass Pro is. All right, let's see the names will be flashed right now. It's Ancilia Estomago. Congratulations, Ancilia. Thank you for following the mechanics. It's a lot of technicalities. Some people got disqualified because we couldn't verify their post. All right, Ancilia Estomago, you won an NCLEX review package from Aspire RN SurePass Pro. All right, to claim your prize, please send me an email paul@aspirern.com. All right. This is my email right now, flashed on the screen in front of you. All right. Please message me at paul@aspirern.com. All right. That's for Ancilia Estomago. Congratulations for winning. All right. Here she is. You are most welcome. She just commented, thank you. You're welcome. All right. Thank you for joining the show. And our next winner of NCLEX review course plus application fees for the NCLEX is Rio Jill Abigail Harillo, right? Or Hario, right? Rio Hario, you have won an NCLEX review course plus application processing fees. Congratulations and thank you for joining the show, all right? To claim your prize, please message me at paul@aspirern.com. All right, Rio Hill Harillo, are you still here? Thank you for joining the show and congratulations. You have won both NCLEX review course plus processing fees. To claim your prize, please message me, paul@aspirern.com. Thank you for everyone who joined. There will be more chances to win NCLEX review courses in my next shows. All right, guys, please join my next show. The next Secrets of Next Generation NCLEX will be coming back on October 15 to talk about types of questions in the NGN. We're going to be dissecting the different types of questions. All right. Next week, October 8th and October 22, we're going to be talking about USA Nurse Series for foreign graduates, Chasing the American Dream. I have a special guest, Miss Tanya Friedman. So please join us next week. All right. And we're going to be seeing you. Please follow my my Facebook page and YouTube to know more about our future events. All right. Thank you so much for joining the show, and we'll see you next time.
You have just watched the Dr. Nurse Paul Show. Watch us live every Saturday, 8 a.m. Central U.S. Time. For more info about our future events, follow us on our social media channels. You can find us at Dr. Nurse Paul on Facebook, Instagram, TikTok, and YouTube. See you next week.